How are neural networks transforming the field of medicine? Now, that's a question that's been buzzing around in the medical community, and for good reason. Neural networks, a subfield of artificial intelligence, have been making significant strides in the healthcare sector, and it's all thanks to their ability to process and analyze vast amounts of data. Picture this: a neural network is a computational model designed to mimic the human brain. It's made up of interconnected nodes, or neurons, that process information and make decisions. In medicine, these networks serve as powerful tools, capable of recognizing patterns and making predictions based on large and complex sets of data. Their potential is expansive, covering a wide spectrum of applications. At one end we have diagnosis. Neural networks can sift through electronic health records, imaging data, and genetic information, identifying subtle patterns that might escape the human eye. This can lead to early detection of diseases, sometimes even before symptoms begin to manifest. On the other end of the spectrum, we have treatment efficacy prediction. Imagine if we could predict how a patient would respond to a specific treatment before it's even begun. Neural networks make this possible by analyzing the patient's data and predicting the likely outcome of different treatment options. This can guide healthcare providers in personalizing treatment plans, potentially improving patient outcomes and reducing healthcare costs. In between these two ends of the spectrum, there are countless other applications. Neural networks can aid in drug discovery, optimize treatment plans, and even assist in surgical procedures. The possibilities are as vast as the data these networks can process, but this is just the tip of the iceberg. As technology advances and our understanding of both medicine and artificial intelligence deepens, the role of neural networks in healthcare is set to expand even further. As we delve deeper into this topic, let's consider a real-world case study that illustrates the use of neural networks in medicine. Imagine a world where early cancer detection is not just possible but highly accurate. In this new era of medicine, neural networks are playing a crucial role in making this vision a reality. A clear illustration of this is found in the use of neural networks in cancer diagnosis. Let's delve into a case study to understand this better. Neural networks are essentially learning algorithms that mimic the human brain. Just like the brain learns from experiences, a neural network learns from data, and in the context of cancer diagnosis, this data is primarily in the form of medical images. Now, consider a situation where a neural network is trained with thousands of images of both cancerous and healthy cells. Each image is labeled, indicating whether it shows a cancerous cell or not. The network studies these images, learning to recognize the subtle differences that distinguish a healthy cell from a cancerous one. This process is known as training the network. Once this training is complete, the neural network can then be presented with new images, ones it has not seen before. Here's where the magic happens. The network applies what it has learned to these new images, identifying potential cancerous cells with remarkable precision. This method of early cancer detection has been put to test in numerous studies. For instance, a study conducted at Stanford University used a neural network to identify skin cancer. The network was trained on a vast data set of skin images. The result? The neural network matched the performance of dermatologists in identifying skin cancer. The benefits of this approach are evident. With such a system in place, early cancer detection becomes not only possible but highly accurate. This increases the chances of successful treatment and potentially saves countless lives. But it's not just about early detection. Neural networks can also help in monitoring the progress of the disease and assessing the effectiveness of treatment, which we will discuss later. This case study highlights the potential of neural networks in revolutionizing medical diagnosis. And this is just the beginning. The future holds even more promise as we continue to refine these systems and uncover new applications in the field of medicine. What if we could predict the outcome of a treatment before it's even started? This isn't a pipe dream, but a reality that's being shaped by the use of neural networks in medicine. Let's delve into a case study that shines a light on the powerful role neural networks play in predicting treatment efficacy. Imagine a world where doctors could tailor a treatment plan to each patient's unique biology and circumstance. This is where neural networks come in. These systems can analyze patient data, including medical history, genetic information, and lifestyle factors, to predict an individual's response to various treatments. Let's take the example of a study conducted by researchers at the University of California, San Francisco. They developed a neural network model to predict treatment outcomes for patients with brain tumors. This model analyzed MRI scans, genetic data, and clinical information, and was able to predict with high accuracy the patient's responses to different treatment strategies. This prediction is not just about whether a treatment will work or not. It's about predicting the degree of efficacy, the potential side effects, and the overall impact on a patient's quality of life. It's about understanding the subtle interplay between a patient's unique biology and the proposed treatment. What does this mean for patients and healthcare providers? Well, it means more effective and personalized treatment plans. It means fewer trials and errors, less unnecessary suffering, and a faster path to recovery. It means that instead of taking a one-size-fits-all approach to medicine, we can deliver personalized care that takes into account the intricacies of each individual's biology. It's important to note, however, that while neural networks show great promise in predicting treatment efficacy, their implementation in the real world is still in its early stages. Rigorous testing, validation, and ethical considerations must be addressed before these systems can become a standard part of medical practice. Nevertheless, the potential is undeniable. This predictive ability of neural networks brings us closer to the world of personalized medicine. A world where each patient receives a treatment plan as unique as they are, maximizing their chances of recovery and minimizing their suffering. That's the power and promise of neural networks in medicine. With such impressive applications, what does the future hold for neural networks in medicine? As we gaze into the crystal ball, the potential of neural networks in transforming the medical field appears boundless. Let's consider genetic research, for instance. Neural networks could be harnessed to sift through the vast and complicated human genome, identifying patterns and associations that could provide insights into genetic diseases. Imagine being able to predict a person's likelihood of developing a certain genetic disorder, or better yet, devising personalized treatment plans based on an individual's unique genetic makeup. That's not science fiction, folks. That's the power of neural networks. Turning our attention to drug discovery, it's no secret that this process is often long, expensive, and fraught with uncertainties. But what if neural networks could streamline this process? By analyzing the complex interactions between molecules and biological systems, neural networks could predict the potential efficacy of a new drug compound, significantly reducing the time and resources needed for clinical trials. We're talking about a future where life-saving medications are brought to market faster and more efficiently. Now let's talk about patient monitoring. In a world where wearable technology is becoming the norm, neural networks could play a pivotal role in real-time health monitoring. By analyzing data from wearable devices, these networks could detect anomalies in a patient's vitals, potentially predicting serious health events before they occur. Picture a world where your smartwatch doesn't just tell you the time or count your steps, but also alerts you to an impending health crisis. These are just a few examples of the potential applications of neural networks in medicine. But the sky's the limit, really. As these networks become more advanced and our understanding of their capabilities grows, who knows what other breakthroughs lie on the horizon. The possibilities for neural networks in medicine are only limited by our imagination. Today we've explored the role of neural networks in medicine and how they are shaping the future of healthcare. We've seen how these complex systems, which mirror the human brain's own neural network, are being harnessed to process and analyze vast volumes of data in a way that simply wasn't possible before. We've journeyed through the fascinating world of cancer diagnosis, where neural networks are revolutionizing the way we detect and understand this multifaceted disease. Through analyzing patterns and anomalies in medical imaging, these networks are able to identify early-stage cancers with remarkable accuracy, providing a new line of defense in our ongoing battle against this pervasive illness. From there, we moved on to the realm of predicting treatment efficacy, another area where neural networks are making their mark. By assessing patterns in patient responses to different treatments, these networks can predict the likelihood of a treatment's success, enabling medical professionals to tailor their approach for each individual patient. This not only increases the chances of successful treatment, but also minimizes unnecessary side effects and boosts overall patient well-being. And finally, we dared to look into the future, to envisage a world where neural networks are an integral part of every aspect of medicine. From disease diagnosis and treatment planning, to pioneering new therapies and even predicting future health trends, the potential applications of these networks are truly staggering. So what does all this mean? Well, it means we're on the cusp of a new era in healthcare. An era where the power of artificial intelligence and neural networks is harnessed to its full potential, enabling us to better understand and treat a wide range of diseases and conditions. As we continue to unlock the potential of neural networks, one thing is clear: they are set to play an increasingly significant role in advancing medicine